This video was made for the Mount Sinai Hospital Emergency Department staff and is intended to demonstrate the correct technique for getting into and out of the personal protective equipment required for healthcare workers to safely care for patients with suspected or confirmed Ebola virus infection. The information contained in this video is current as of October the 16th, 2014. A key concept in this video is understanding the line marking the clean and contaminated areas of the anteroom outside the isolation room. In this video, the healthcare worker is donning their PPE in the clean area to the right of the yellow line, careful not to enter the contaminated area to the left. Additionally, the donning and doffing of all personal protective equipment is to be performed in the presence of a buddy to ensure that all steps are performed in the correct sequence. Step 1. Remove all unnecessary layers of clothing. Step 2. Ensure all hand and wrist jewelry is removed and hair is tied back. Identify your prepackaged PPE kit, remove and review the contents. Step 3. Put on shoe covers. Remember to fold down the top lip to facilitate doffing. Step 4. Perform hand hygiene. Step 5. Put on your fit-tested N95 respirator. This will not be in the kit. Pinch the nose piece and perform a seal check. Step number 6. Put on the white impermeable hood. Ensure that the straps run through the loops on the sides of the hood. Tie the straps at the back of your head. Lay the edges of the hood down flat against your body. And pull the hood down so that it comes to just above your eyes. Step number 7. Put on the water-resistant gown. These gowns are intentionally long and should extend below the top of your shoe covers. As you put the gown on, reach inside around the neck to ensure that the edges of the white hood are still flat against your body, and secure the neck of the gown at the back with the Velcro tab. Do not tie up the inside of the gown. Instead, tie up the outside of the gown and secure the edge with tape. This is the perfect time to have your buddy check that your gown is properly fastened and secured, that the edges are tucked properly inside, and that there are no exposed areas of clothing. Have your buddy tape the outside edge of the gown. This will keep the gown closed, but allow it to be easily removed once you emerge from the isolation area. Step number 8. Put on the face shield. Extend the flap at the bottom of the face shield before you put it on. Have your buddy ensure that at least half a centimeter of white hood can be seen below the foam headband, and also have them pinch the tab at the bottom of the flap to ensure a proper fit. Step number 9. Put on the plastic cap. Ensure that it covers the foam band of the face shield. Step 10. Put on the first pair of long cuff gloves over the cuff of the gown. Have your buddy put a strip of tape along the backs and front of each glove, taping the cuff of the glove to the sleeve of the gown. This will be important when you remove the gown, as it will hold the gloves on, and you will remove the gown and the gloves as a single piece, minimizing the risk of contamination. Step 11. Put on a second pair of long cuff gloves, pulling the cuff up over the cuff of the gown. Have your buddy check you once your donning is complete to make sure that you have done it correctly.